Here you can see a very clear image. This is a sectional image by 3D. This is the cervical entry. Go inside roughly where the internal os lies. You can see this entire part which I am pointing out over here. This is the endometrial cavity right here, all the silverish over here. Over here the dark gray area is the myometrium, as in the muscle, and you can see this entity over here is your pregnancy. This is the cornual, this is the interstitial part. So this pregnancy has occurred in the fallopian tube, the intramyometrial part of the fallopian tube. That is the fallopian tube which is connecting the fallopian tube proper and the cavity here. So actual fallopian tube is outside, and over here it's connecting with the canal, the endometrial cavity right here. So I'll just show you the different sections. So you can see over here, and as we go down and down and down, there you can see the sac starts appearing, and over here the sac is disappeared. So this over here you can see this is the closest proximity that you are getting. So here what we end up doing is, I'll just take a few measurements. So one cursor over here and one cursor over here. Okay, so this is what I am placing, and over here you can see it is more than 1 centimeter, and this by rule is the definition of a this is called the interstitial line, which is one of the diagnostic criteria to label whether it's a ectopic pregnancy or not. So over here another thing is you have to measure the myometrium over here, and the maximum thickness over there should be less than 0.5 centimeters, that is less than half centimeter, and that proves, if you have both the criteria met, then it proves that it is an interstitial pregnancy. Another thing that is very important is DNC will not solve it. The reason being, DNC can take care of anything in this area, but DNC will not go there. For this you have to do a laparoscopic approach in case you are planning surgical. Another way to go ahead is to use medical therapy to get rid of the ectopic pregnancy. Medical therapies usually have a small risk of bleeding, and SOS laparoscopy should be kept standby in those cases. Thank you so much.